then we're good to go, right?
Yep. Good afternoon, everybody. This is Mark Markuson. I am the sales manager for the Johns Hopkins Medicare Advantage programs. I want to thank you all for joining us this afternoon to take some time out of your busy day to listen to what Johns Hopkins has to offer as far as the Medicare Advantage plans for 2018. I'm going to run through the slides. I would ask that you hold your questions until the end, as a lot of times the questions are going to be answered as I run through these slides. So I'm going to get started. We're going to do a little bit of Medicare 101 just to familiarize your folks with what Medicare, basic Medicare is all about, and then we'll get into the Johns Hopkins plans. Okay, during this meeting, as I mentioned, you're going to learn about the Medicare, the Johns Hopkins Advantage plans. We have basically 3 plans. We have 2 PPO plans, which is a preferred provider organization, and we have 1 HMO plan. Whoops. Okay, who can join the Johns Hopkins Medicare Advantage plans? Well, you have to have both your Part A and Part B. You can't have end-stage renal disease, and you have to have a permanent residence in the service area. The service areas for the Johns Hopkins Medicare Advantage plans are Anne Arundel County, Baltimore City, Calvert, Carroll, Howard counties, Frederick, Montgomery, Somerset, Washington, Wacomico, and Worcester counties. You have to be a permanent resident in one of those counties or Baltimore City in order to join our plan. So let's go over some Medicare basics. There are several different Medicare election periods. You have your initial election period, which is 3 months before, the month of, and 3 months after your 65th birthday. Then every year, from October 15th to December 7th, we have what's called AEP, which is your annual election period. Then from January 1st to February 14th every year, we have what's called the Medicare Advantage disenrollment period, at which point in time you can go disenroll from a Medicare Advantage plan and go back to original Medicare. Then throughout the year, we have what's called special enrollment periods, SEPs. And those, you have certain circumstances that will allow you to change your Medicare Advantage or prescription drug coverage, such as if you move into the area from somewhere else. So let's go over the parts of Medicare. Okay, this is Part A. This is your standard Medicare Part A. This is your hospital insurance. Part A is free for most people. For 2018, there's a $1,316 deductible per benefit period for your Part A. After 60 days in the hospital, from days 61 to 90, you're responsible for $329 a day copay. From days 91 to 150 days in the hospital, you're responsible for $658 a day. After day 150, you pay all hospital costs. That's your standard Part A under Medicare. Part B is your doctors and your diagnostic, the medical insurance. Part B is optional, and for 2018, there's a $134 standard per month premium for your Part B. Part B covers 80% of your medical insurance, leaving you the other 20%, an 80-20 insurance program. And for 2018, there's a $183 annual deductible for your Part B. That's your standard Part A and Part B for Medicare. Part C, your Medicare Part C, is a Medicare Advantage plans offered by private companies such as Johns Hopkins. And they cover some of the costs not covered by original Medicare. They can include extras such as fitness and wellness programs. Some can include vision, dental, and hearing options above original Medicare. Many offer prescription drug benefits. The Johns Hopkins Advantage MD is a Medicare Part C plan with a prescription drug benefit. Your Part D is your prescription drug coverage. When you get Part D coverage as part of a Medicare Advantage plan, or you can get it as a standalone drug prescription plan. They're run by private insurance companies. You pay a monthly premium. You pay a portion of the drug cost, and then the coverage can vary from plan to plan. Your standard Part D has 4 phases. You have your deductible, your initial coverage phase, your coverage gap, or the donut hole as they call it, and then the catastrophic coverage. So, in your deductible for 2018, the deductible is $405. Then once you meet your $405 deductible, you go into what's called the initial coverage phase. For the next $3,750, that's a cost sharing. The plan pays 75%, you pay 25% under your standard Part D. Once you and the plan pay out $3,750, you go into what they call the coverage gap, and for the next $5,000, you're going to pay 35% of brand name prescriptions and 44% of generic prescriptions. Once you pay out $5,000, you enter what's called the catastrophic phase, where you're going to pay 5% or $3.35 for generic or $8.35 for brand names, whatever is greater. That is your standard Part D prescription drug benefit under Medicare. So you can get extra help paying your Part D if you're on a low income subsidy, and that's available to you from the government if you meet certain income requirements. And those that qualify may get help paying monthly premiums, co-pays, co-insurance, and deductibles. If you qualify, you won't know if you qualify unless you call Social Security, and they'll let you know what the income levels are for your low income subsidy. So, choosing the right plan. Well, this is a very individual situation. So when you choose a plan, you want to consider your own individual needs, such as cost, benefits, doctors and hospital choice, your health history, and the convenience of where your doctors and hospitals are. So let's talk a little bit about the Advantage MD plans offered through Hopkins. In 2018, Hopkins is proud to present, we have 2 PPO plans. We have a PPO and then a PPO Plus. And this year we're rolling out an all-new Hopkins Advantage MD HMO plan. So, how a PPO plan works. A PPO stands for Preferred Provider Organization. Obviously, the Preferred Provider Organization in this particular case is the Johns Hopkins Doctors and Networks. With a PPO plan, if you stay in network, you see your primary care doctor, your specialist, you have very low co-pays. The nice thing about a PPO plan, you can go out of network and you don't need referrals, and if you go out of network, some of the costs may be higher, but you can go out of the plan. An HMO, how an HMO works, you have to pick a primary care doctor that's in the network, and then that doctor will refer you to the specialist. If you go outside of the network on an HMO plan, everything that you do, you have to pay at 100%. Those are the differences between a PPO plan and an HMO plan. So, the Hopkins Advantage PPO plan, the premium for that, for in-network, is a $47 a month premium. Your maximum out-of-pocket is $6,700. Your primary care doctor visit is $10. Your specialist is $50. If you go into the hospital, the first 7 days you're in the hospital, you have a $285 a day copay for the first 7 days. After day 7, everything is covered at 100%. Outpatient hospital coverage is $395. Excuse me. Emergency room is $80. Ambulance is $300. Preventative care is $0. And there's a slide that I'll go over all the preventative care options to you. You do have your prescription drug card covered with generics as low as $7. And you do get some dental, vision, and hearing benefits with the PPO Advantage plan. The PPO Plus is a $78 a month premium. Your maximum out-of-pocket is $5,900. As you see, the primary care doc visit drops to $5. The specialist goes to $40. Your inpatient hospital stays from days 1 to 7 dropped to $255. Outpatient hospital coverage is $275. Emergency room is the same at $80. Same with the ambulance at $300. You get your preventative care for zero copay. In the PPO Plus plan, we do have the Silver and Fit program, and it's included at no cost, and I'll go over that in another slide. You do have prescription drug coverage with generics as low as $4. You get your vision, dental, and hearing benefits, and this year we added worldwide emergency care coverage for $80 copay. That is your Advantage Plus PPO. The HMO is $25 a month unless you live in the city where it's a zero premium. Your out-of-pocket maximum is $6,700. Your primary care doc visit is $5, specialist is $50. Your inpatient hospital stay for days 1 through 7 is $285. Outpatient hospital is $330. Emergency room is $80. Ambulance is the same at $300. Preventative care at $0. You do get a prescription drug coverage with the HMO with generics as low as a $0 copay, and you get some dental, vision, and hearing benefits with the HMO as well. This slide here is a comparison of everything that I just went over. So I'm just going to take a few minutes and let you look at that to see the differences between the premiums and some of the copays involved. So we talked a little bit about the preventative services available at zero copay on all three plans. Included in some of those in-network at no extra cost are your annual physical exam, immunizations, your screening for mammograms, pap smear, and pelvic exams, prostate screening, colorectal screening, nutritional education, a 24/7 nurse chat line, smoking cessation, a Hopkins specialty appointment line, which is a really nice benefit to have. I don't know if any of you have ever tried to see a specialist and they say it might be 30 days. We have a number that you can call to help expedite that to get you in quicker. eye disease screening and diabetes screening. These are all available to you in network at no cost on all three plans. In addition to the monthly premiums for your Hopkins Advantage MD plans, we do offer a supplemental dental plan. Under the Hopkins plans, you do get cleanings and x-rays either once or twice a year, depending on the plan that you pick. If you would like to get a supplemental dental plan, it is available to you at $28 a month, and all members can purchase this. And the plan includes such services as extractions, root canals, crowns, dentures, oral surgery, restorations, and things like that. There is a 6-month waiting period once you enroll in the supplemental dental plan, so that's just something to think about. The Silver and Fit program is what I talked about earlier that comes at no cost to you with the PPO Plus plan. And it's a fitness plan designed especially for older adults, and you can work out at one of our designated facilities, or you can work out in your own home. And you can choose to work in your home. You can order DVDs, and you can choose from yoga, Pilates, Tai Chi, cardio strength, and things like that. And you can also participate in the healthy aging classes. This is a really nice benefit that's available to anyone that enrolls in the PPO Plus plan. All three plans have hearing aid coverage, which is above and beyond original Medicare. Johns Hopkins offers 2 hearing aids per year when purchased through True Hearing. You either pay $699 or $999 per hearing aid. In addition to that, you would get 3 follow-up visits with your True Hearing provider, a 45-day trial, a 3-year manufacturer warranty, and a one-time loss for damage, and a 48 batteries per aid. So this is a really nice additional coverage for the Johns Hopkins Medicare Advantage plans. So things to know. Johns Hopkins MD is a Medicare Advantage plan with a Medicare contract offering HMO and PPO products. Enrollment in the Johns Hopkins Advantage MD, HMO, or PPO depends on an annual contract renewal through the Center for Medicare and Medicaid Services. This information is not a complete description of the benefits. You want to contact us for more information. You can also refer to the summary of benefits for more information. Limitations, co-payments, and restrictions may apply. Benefits premiums and/or co-insurance co-payments may change every January 1st of each year. You must continue to pay your Part B premium in addition to the premiums to Johns Hopkins in order to be in one of our plans. More things to know. The formulary in the pharmacy and the provider network can change at any time. If necessary, you will receive notice. Out-of-network contracted providers, they're under no obligation to treat the Johns Hopkins Advantage MD members except in emergency situations. For decisions about whether we cover an out-of-network service, we would encourage you or your provider to ask for a pre-service organization determination before you receive the service. You can call our customer service number or see the evidence of coverage for more information, including the cost sharing that applies to out-of-network services. So that's my story, and I'm sticking to it. If there's any questions, I think you can type them in, and I'll try and answer them in order. Okay, I see one question. Do I need to go to Baltimore for my health care? No, you do not. You can, if you go to a PPO, if you pick one of the PPO doctors, you can, go to any doctor you want to. If they're in network, obviously the copays are less. Same with the HMO. You can pick a doctor that's close to your home, so you do not have to go to Baltimore. Okay, next question. Is Advantage MD a supplemental plan? No, it is not. A supplement plan is totally different than a Hopkins Advantage plan. Any other questions? If I enroll in Advantage MD, will I lose my original Medicare? Hopkins will then, if you enroll in a Hopkins plan, Hopkins takes over your Medicare. You would get a Hopkins card in the mail, and instead of showing your red, white, and blue card going forward, you would show your Hopkins card. Next question. How can I see what dentists are in our plan in Annapolis, Maryland? What you can do to see dentists, doctors, hospitals, you can go onto HopkinsMedicare.com. You can click on Find a Provider. Once you do that, it'll take you to a screen that says, do you want to leave the Hopkins website? You would click on Yes. The next screen that comes up will show you what plan you're interested in enrolling in, whether it be the HMO or PPO. You would click on one of those, and you would come down and put your zip code in. And then once you put your zip code in, within 10 miles of that zip code, you'll click on whether it's a primary care specialist lab, and it'll show you all those doctors or hospitals within that 10-mile zip code. Does the Silver and Fit plan cover membership in a gym like the Y of Central Maryland? There are some gyms that are included in that. The Y, I believe, is in the Silver and Fit program. You can go to the website, the Silver and Fit website, and you can find out all the gyms that are in the Silver and also to the Hopkins website to find out what gyms are in the network. Next question. If I travel outside of Maryland and in the U.S. and I have an emergency, am I covered or do I need a PPO Plus plan? No. If whatever plan you pick, as long as you're in the United States of America, if there's an emergency, even if you're in Boise, Idaho, if it's a life-threatening situation, you get to the hospital. While you're in the hospital, it would be treated as an in-network situation. Once you're stabilized and released, you would then come back and then have your Hopkins doctors for follow-up visits. I will say that all the urgent care facilities across the country are in the network. So you can go to an urgent care center for either $40 or $45 if it's not life-threatening. But if you feel that it's life-threatening, get to the closest hospital, and you do have coverage in an emergency situation. Can you switch back to Advantage MD later from original Medicare? Well, you do have that disenrollment period where you can leave Advantage MD from the 1st of January to the 14th of February. Then during open enrollment, if you go back to original Medicare during open enrollment, you can then go back to an Advantage MD plan. Any other questions? You can call me. As you can see, I've got my beautiful picture there on my cell phone, 410-241-0788, if you have any additional questions, and I will point you in the right direction and answer any questions you might have. So if there's no more questions, I want to thank you all for joining. And are these slides?
Yes, they'll be, the presentation will be available on the website.
Yeah, this presentation will be available on the website in 24 or 48 hours, I believe. So if you want to listen to it again, you're good to go. So I guess that's it. Thanks, everybody. Have a good day.